All right, so thank you very much for being here. I would like to introduce to all of you the Mayor of West Hollywood, the Honorable Lindsay Horvath.
Thank you so much, Hernan, and thank you to everyone who is making today's panel possible. I know these things seem very easy when we're in this virtual space to come together, but we know it takes some planning, and I just want to thank everyone for making themselves available and the work that they did to make this come together. It's certainly helpful for us to have a space to ask questions, to provide information as we're learning it. You know, when this first started, everything was sort of unknown, and as we're learning things, and we want to make sure we're continuing to educate the community, making sure we're providing the most up-to-date information and the best practices that we can be adopting as a community to help fight COVID-19, to flatten the curve, to keep everybody safe and healthy, to get our businesses back up and running in a safe and smart way, and to do all that we can to fight this horrible, horrible crisis that we're all facing. I want to thank our panelists who are joining us today for sharing their time, and this wouldn't be possible without all of the City Council support. I know Councilmember Maestra really led this effort, and so now I will turn it over to her.
Thank you very much, Mayor, and welcome everyone, and thank you for joining this panel discussion and Q&A on COVID-19. We put together this panel to provide community members with the most up-to-date information, and I know that there's a lot of confusion out there. People aren't sure, should they dine out? Should they be wearing their masks here or there? So we just wanted to give the community an opportunity to ask questions and just bring everyone up to date. I want to thank Dr. Riggs for being here, and Cristin Mondy, and I'm going to turn this over to our wonderful legislative analyst, Hernan Molina, and wonderful moderator. Thank you so much for being here, everyone. And I know that this is going to be an informative panel and Q&A. Thank you.
Thank you very much, Councilmember Maestra. Thank you very much, Mayor, for the introduction and for allowing us to put together this discussion and work with two wonderful individuals, which I'm going to go ahead and introduce next. The first panelist is Dr. Richard Riggs, who was appointed Senior Vice President and Chief Medical Officer for the Cedars Sinai Health System in October of 2019. Since 1997, Dr. Riggs has served as the chair of the Department of Physical Medicine and Rehabilitation at Cedars Sinai, and is a clinical professor at Cedars Sinai and Health Sciences, clinical professor at David Geffen School of Medicine at the UCLA here in Southern California. Dr. Riggs is also a published author and has lectured around the United States and internationally on clinical, operational, and leadership topics in physical medicine and rehabilitation, health services research, and clinical informatics. Dr. Riggs also completed his medical education at the Medical College of Georgia and trained in Philadelphia in conjunction with the University of Pennsylvania. Dr. Riggs is a board certified in physical medicine and rehabilitation and clinical informatics. Dr. Riggs, thank you very much for being with us and welcome to this panel. And our next panelist is Cristin Mondy, who is the Regional Health Officer for the Los Angeles County Department of Public Health, Metropolitan Los Angeles, SPA 4, also known as the Service Planning Area. Number 4, she directs the operation of core public health services for approximately 1.1 million residents within the region of Los Angeles County. Ms. Mondy is responsible for field staff operations related to communicable and chronic disease prevention and community engagement. She also maintains relationships with community partners such as the City of West Hollywood to design effective and evidence-based community programs to support the development of healthy, safe, and active environments throughout metropolitan Los Angeles. We have obviously a great panel. Thank you, Cristin Mondy and Dr. Riggs for being with us. Ms. Mondy does not mention in her bio, but I will mention because she is a nurse. She's a nurse practitioner and a Master of Public Health, which is an amazing accomplishment. And nurses and doctors both are doing great work to protect us and take care of the sick. I would like to start this panel by offering to our audience a frame of where we are, a situational status, if you want, here in Los Angeles County. And both Dr. Riggs and Cristin Mondy are going to elaborate in these points and talk, for instance, about where we are in the tier system, the color tier system that the state has put together. As of yesterday, the county has reported 810 new cases of COVID-19, and the total number of people who have been infected so far in Los Angeles County is 260,133 people. The county's 7-day positivity average has been trending down and is now at 2.9%, excuse me. Testing seems to have also gone up. At one point, there was an interruption due to the fires. Yesterday, the Department of Public Health as well reported another 40 deaths, which brings the total number of lost lives to COVID to 6,401 persons. We have also seen marked improvements in the number of hospitalizations. And there are, as of yesterday, 745 individuals hospitalized in LA County. 28% of these individuals are in the intensive care unit, and another percentage of that are being ventilated, which we're also going to talk with Dr. Riggs for him to give us a broader, more clear picture of what it means to be in the ICU with COVID. This number may be flat now as opposed to continue to decline. So you know, almost 20,000 people have been hospitalized so far in LA County. The current status of the color for the county is purple, which is considered widespread, and based on these figures, Ms. Mondy will tell us where we are headed, what's happening, particularly as the county continued to experience a downward decline on the number of COVID cases. So let me begin with the questions, which I just lost. And give me 1 second, please. Too many windows open. There we go. So the first thing that we wanted to talk about is both of you are in leadership positions. Dr. Riggs with Cedars Sinai, as I mentioned at the beginning, and Ms. Mondy with the Los Angeles County Health System. Can you please describe on your roles, how are we doing to mitigate this public health emergency, and more importantly, its impact in the community? And if Ms. Mondy, if you could start, that would be great.
Thank you so much, Hernan. First of all, good morning to everyone. I'd like to thank the City of West Hollywood, who's really been a partner and a leader in, with the COVID-19 response. I'm so honored to be part of your panel today. So as Hernan mentioned, my regular role within the Department of Public Health is a regional health officer. But since COVID-19, the department has restructured so that we can respond appropriately. And for this COVID-19 response, I serve as the operations deputy for the Department of Public Health. So in this capacity, I help oversee the activities of over 4,000 staff. This includes staff from the Department of Public Health, disaster service workers from other county departments, contract staff, and even state employees that have been temporarily reassigned to Los Angeles County. I'm going to be describing very briefly some of the major activities that we do within, the operations within the department. So first, we follow up on all COVID cases. We provide education and ensure that they're isolating. We also do contact tracing, which is a simple, confidential process that has been used by public health departments for decades to slow the spread of infectious diseases and avoid all outbreaks. All contact tracing efforts are managed and overseen by public health. We identify, investigate, and manage outbreaks. To date, we have investigated about 1,800 outbreaks and are currently managing over 450 outbreak investigations in diverse settings such as skilled nursing facilities, workplaces, food and retail stores, and homeless service settings. We also issue health officer orders. You probably have heard the reopening safer at work and in the community for control of COVID-19 order. It's a legal order issued by the Los Angeles County Health Officer to help slow the spread of COVID-19 and protect the members of our community who are at greater risk for serious illness due to COVID-19. The order is consistent with the California's COVID-19 executive orders and health officer orders. I do want to remind everyone that this is a legal order. This is not a guidance. It is a directive that must be complied with. And we actually have compliance teams visiting establishments across Los Angeles County every day. We also issue individual isolation orders to cases and individual quarantine orders to close contacts. And to date, we have issued almost 300,000 isolation and quarantine orders to residents. Our staff collect and monitor data. As many of you know, COVID-19 is a mandatory reportable disease, and public health manages all the data that is reported from laboratories, healthcare providers, and hospitals. Our staff work really hard to collect, monitor, and manage daily updates, data trends and graphs, and explanations about what the data is telling us. And this data is accessible in our website. We also oversee medical sheltering sites that serve people experiencing homelessness and anyone who cannot safely isolate or quarantine in their own home. Our sister agency, Department of Health Services, is in charge of the overall testing strategy in Los Angeles County, but we in public health do testing in high-risk settings such as skilled nursing facilities, shelters, and encampments. We also do community outreach and engagement, providing relevant and timely messaging for the community that is designed to promote preventive strategies and remind the public on how to stay safe. We are engaged in a lot more COVID activities, but I think I'm gonna stop here and give Dr. Riggs an opportunity to share what his role is.
Thank you, Cristin. I want to also thank Hernan for hosting us today, and for the council, West Hollywood, for inviting us. Indeed, they have been a great partner with us also, and facilitated actually traffic control for our drive-through testing when the county was open, which was very helpful because that was a large number of folks per day. So the question about how we're responding to the health emergency and its impact in our community, I think has to be answered in phases from my standpoint, because initially when we had the first patient admitted at Cedars at the end of January, we knew absolutely very little about this virus and the types of sort of sequelae that it may have. So early on, we were trying to understand the virus and preparing to treat folks who were impacted in mild to severe ways. And of course, you remember that the waves hit in New York and Washington much earlier. And so there was this fear factor that, wow, you can't allay that when you don't know how to. And it really was palpable for many of the caregivers here. So in the summer, we were, encouraged that people who had, we were encouraging people that had delayed care not to delay care anymore, because we were seeing folks that had things like abdominal pain come in with ruptured bowels because they were afraid to seek care. So in the sort of summer, we needed to restore health care for our community and understand how we can have that balance of keeping our folks safe, keeping our patients safe, keeping everybody well, informed, and working, of course, for the community here at Cedars Sinai. And then currently, we want to try to mitigate the sort of, I'll say, uncontrolled spread of the virus, and understanding that all of the testing that Cristin and her team are doing in the outbreaks in assisted living facilities or residential, other types of homes, is very important, because the age is a significant indicator, a prognosticator in a poor way. The older you are, the sort of higher mortality and morbidity occurs, and that's partly just because of the physiology of the body in some of those, sort of over 80-year-old years. And so that was our first way So right now, I think that we're attempting to make sure that we can be in this for the long haul. You can imagine that day in, day out, we screened over 1 million people coming onto our campus since we started the screening. And that's all new work, right? It's all, and so you can imagine that for every restaurant, for every shop, for every person, that this is something that we are adjusting to. I don't know if you've done it yet, but I've certainly gone to take a drink, and my mask has been on, and it's just like the mask is so much a part of us now that we've gotten used to it. So I think that's where we need to be until we have certainly definitive treatment, either antivirals that we know will work, and or we have some type of other treatment that may be helpful.
You mentioned the mask, and I'm going to ask you if you can very briefly tell us why the mask is so important. People believe perhaps that the mask is something that is going to protect them, but what are the facts about using masks? We are, and not that I need to clarify this, but we are obviously living in a world that seems to be divided between those who deeply believe in the mask and those who are following our elected officials, that unfortunately our president, in not necessarily wearing the mask as often or at all.
Right. So my mask is for you. Your mask is for me. Right. So my mask is to keep my viral particles, if I have any, or any of my expiration sort of trapped here. It creates moisture, makes it heavier droplets. It keeps things. It keeps my bacteria and viruses and my excretions here with me, and so that your mask does the same. So and we the irony of folks that are not willing to wear a mask is that they don't know what the person standing beside them, what kind of comorbidities they have, or maybe they're immunosuppressed, or they have someone that's immunosuppressed at home. And so it really is very much a matter of respect, actually. It's unfortunate that there are folks that don't believe that 200,000 people have died in our country, and that this is indeed something that we're going to be living with for a while. It's not going to vanish suddenly. And so we should be taking this seriously. And I would say that it's a matter of respect in all those places, of elevators and places where people may just come on. I've gotten off more than once because I want to respect other people's space where we can facilitate the best for our entire community.
Thank you. And when we talk about the mask, we talk about covering both the nose and the mouth, because I see people walking around with right here.
Absolutely.
Which is not exactly helpful.
Right. Yeah, it has to be, yes, you need to cover both of those breathing places, both the nasal and the mouth. And indeed, that is one of the, it is harder to talk and some of those things, but you can do that later and or when you're not around other people.
When we reopened at the beginning of the summer, we were going back to some sense of normalcy, and unfortunately, some people took that normalcy to mean that we were going back to life without COVID. And then we saw what happened. We ended up having to shut down, for instance, gyms, restaurants, in-dining had to be shut down. The hospitals got flooded with new patients. I was talking at the beginning when I gave the situational status that we are seeing less people hospitalized. How are things inside Cedars, being one of the premier destinations in Southern California for great medical care and all the expertise that you all have developed with these? What's happening inside, if you can give us a situational picture?
Sure, I'm happy to. So at Cedars, since the beginning of the COVID-19, we've admitted about 1,000 patients. with COVID-19, and this is the most number in the Southern California area. And so right now, we have in the 30s range population. You can compare that to earlier in the year in April, we had over 120, 130 patients hospitalized. And again, about 20% of those are in ICU. On a general basis, the folks that come in, I think everybody knows those numbers. About 20% of COVID-19 folks require hospitalization, and of those, 5% are a total of 5% require ICU care, or about 25% of the total that are admitted. So, I think that right now we have developed policies and procedures and operating procedures that allow for us to have routinized the care for folks. We are using universal pandemic precautions, meaning everyone that's caring for patients not only has a mask, but also has eye protection. And then, of course, if they have high-risk procedures, they have N95 masks and or PAPRs to make sure that their air is protected from anything that might be generating aerosol droplets, like intubation, for instance. So right now, we have gone from having several ICUs with COVID patients in them and several floors of patients to really being able to have the much less capacity needed capacity for COVID. But we're not going to put any of those sort of plans that we had before. We can scale as needed, but right now it is it's encouraging. And I do want to mention that the first wave in the nursing homes really created this very, very sick sort of older population. The second wave in July, when people started in June and July, when people started circulating, was a younger population, and that population did not get as sick. Their profile of their disease course was not as bad. Not that many of them didn't wind up on respirators or in needing oxygen support, but their underlying physiology was able to recover at a quicker basis than some of the more elderly and really with lots of comorbidities attached to them.
Great. So I'm going to come back to you, Doctor, and talk about medical breakthroughs, the use of plasma, vaccines, and so on. But since we are talking about where Cedars is at, and clearly there is a decline in the amount of hospitalizations and individuals receiving care in ICUs, I would like to ask Cristin Mondy if you could please tell us where we are headed, because I mentioned in the situational status that our numbers for cases are trending down, so the number of hospitalizations, the doctor is in a way attesting to the fact that there are less people hospitalized. But also the governor a few weeks ago presented a new color tier to basically at a glance to provide people with the situational status of every county, of the 58 counties here in California. In Los Angeles, we are still at purple, and I said still because although the numbers are doing much better, we still have some ways to go. Tell us, if you will, where we are. What does it mean, purple? Perhaps first, so that people understand, and then more importantly, the question that we kept getting asked: when are the restaurants coming back inside? When are the gyms going to reopen? And the like. And if you want, I can remind you the last part, but if you can start telling us by the situational status for the county.
Sure, thank you, Hernan. So this is actually a question that we're asked quite a bit. So in anticipation of that, I prepared like a couple of slides that will help probably explain this tier system or this framework. I believe we gave you those slides, so if somebody can help bring it up, that would be helpful, I think, for the people to understand. So
my colleague Andy.
Sure. but I'll keep talking as you try and put it up. So the state assigns counties to one of 4 tiers, depending on the level of COVID-19 community transmission. So it's ranging from widespread transmission in tier 1 to minimal transmission in tier 4. There are currently 2 metrics used to assign each county to a specific tier. So first is the daily average of new cases per 100,000 residents. And the second is the daily average percent determines what options are available for the county to consider related to sector openings and permitted activities. So counties are only allowed to move into higher tiers if they have 2 consecutive weeks before, 2 consecutive weeks of both metrics meeting the tier threshold. So if you move to a higher tier, meaning the transmission is decreasing in your county, the county remains in that tier for at least 3 weeks before there is a possibility of moving to a higher tier. So this is very much in line with LA County's own approach to cautious reopenings. So if you could move to the next slide. Right now, LA County continues to be in tier 1. So that's purple. And this is because of our current adjusted daily case rate. As of 2 days ago, Monday, our adjusted daily case rate was 8.1 cases per 100 residents. So that's purple. To move to tier 2, our case rate needs to be less than 7 cases per day per 100,000 residents. So as of yesterday, see, things are moving along. Our adjusted daily case rate dropped to 7. And that metric puts us in tier 2, which is red that you can see here. However, as I said a few minutes ago, we can only move to a higher tier if we have had 2 consecutive weeks of the metrics meeting the tier threshold. So we have to stay at 7 or below for 2 weeks before we can move to, officially move to the red tier. So our test positivity rate is 2.9, which is actually good. It places us for this metric in tier 3, which is orange. However, the state places counties in the most restrictive tier when the metrics fall in 2 different tiers. So right now we remain in tier 1 because of our daily case rate. So the next slide, please. So in LA County, like majority of the counties in California, remains in tier 1. If we don't see a surge in cases and hospitalizations associated with activities over the Labor Day holiday, and we continue to reduce the rate of community transmission over the weeks ahead, we could enter into tier 2, a less restrictive tier, sometime in October. So our path forward for recovery depends on us being able to reduce community transmission significantly so that children and teachers can get back to their classrooms and more people can get back to their jobs with as much safety as possible. So once we move officially to tier to the red tier, then we're gonna start making decisions on what additional restrictions can be lifted and what additional things could be reopened. And those decisions are made in collaboration with our Board of Supervisors. Did I answer your question, Hernan? I hope I did.
Yes, you did. You did very well, and I much appreciate it. I think if you could further explain when, let's assume wishful thinking, I think this is very collective wishful thinking, the numbers continue to trend down. When would the county be able to, in communication with the state, say, okay, we can move to the lower tier because our number, or the higher tier, depending on how you look at the color tier test. What are we looking forward in the next couple of weeks? Because what I recall hearing that Labor Day, because of the typical or the tradition of getting together and celebrating, was one of those possible super spreader events, and perhaps we haven't seen that happening. What are we looking down the road, let's say 2 weeks from now?
So like I said, if hopefully we stay, you know, in with our cases 7, you know, at 7 or below for 2 weeks, right? Because we're required to stay in that you know, metric for 2 weeks before we can even move it here. And once we're in red, some of the things that we will consider is you know, like opening restaurants indoors with modifications, of course, and social distancing, gyms, you know, those kinds of things. But we can't even move to making those decisions based on what the framework the state has provided to us. But I do want to say, though, that locally, so the tier, I mean, the state provides these framework, right? But locally, we can be more restrictive. So even though they have recommended, you know, they're saying that if you're in red, you can start, you know, opening restaurants within indoors with limitations, modifications, social distancing, gyms, other places, based on what is happening in Los Angeles County. Like I said, we can be more restrictive, and our health officer, Muntu Davis, our director, Dr. Ferrer, and the Board of Supervisors will be taking all of those things into consideration to when we reopen.
Thank you very much. And one of the things, and I believe we touched on briefly in the previous exchanges, some of our residents, and not necessarily talking about West Hollywood residents, but county residents are becoming perhaps a little more lax. They're getting used to living with COVID. So far, some of them have not been infected. And we see people forgetting about social distance. I was last night doing shopping, which I haven't done in 6 months other than going to the supermarket, and I was at this clothing store at the Grove, and people were online basically next to each other. Well, with masks, but basically next to each other. What's the message, which I personally know the message, but what it's a message from public health experts like you to these folks who are perhaps, because they are fatigued of this, like many people, are not paying attention?
So first of all, I want to acknowledge that this pandemic has been very difficult and frustrating in many ways, you know, because it's placing limits on how we connect with one another. But it's really so important, Hernan, as you alluded to already, it's so important for all of us to be diligent in doing our part to protect ourselves and each other from the spread of COVID-19, because this virus is still widespread in our community. Sure, there's been some improvements, but that doesn't necessarily mean victory. It's still very easy to transmit, and people, you know, often who are contagious don't even have symptoms, so they don't know that, you know, they're sick, but they can transmit it to other people. So the only way things get better is if we can slow the spread of COVID-19 with the tools that we currently have on hand, right? So what are those things? We need to really wear cloth face coverings whenever we're out of our homes and around other people. We need to practice physical distancing of at least 6 feet or more than 3 steps away from others. We should avoid crowds and confined spaces. We really need to be flexible when we have plans to go outside of our homes and be willing to leave any space that becomes crowded. The responsibility lies with all of us, and we, working collectively, have shown the ability to make progress. You know, I do want to say holidays are coming up, right? And we need to encourage everyone to think about how to modify plans to share the joy of the upcoming holiday season while reducing the risk of transmitting a dangerous and sometimes deadly virus. So this means continuing to plan celebrations with members of your own household and reaching out by phone or video to your friends or family members in other parts of the county or the country, right? We need to remember that while we are in this pandemic, the kindest thing we can do for one another is to protect each other from potentially becoming infected with COVID-19. So I know it's really difficult to face seasons and holidays that will not be like what we're used to and how we want them. We may feel less connected and less joyous, but this year is an extraordinary year. It's very different, and we must still all take actions that slow the spread of the virus while we celebrate.
If I can get some quick answers to these few questions that we have received, and we have other questions, and I will get to them when we go to the Q&A, but these are very timely since you are mentioning about what needs to be done, and I invite Dr. Riggs to respond as well. First of all, how safe is dining outside, provided that you're wearing a mask, and then when you get your food plate or drink, you take it off?
So it's safe. You can right now, restaurants are only allowed to open outside. So as long as you make sure that when you're dining outside, you only stay, in the table with your household members, and the others, you maintain
members of your bubble, correct?
I'm sorry?
The members of your bubble, if you will.
That's correct. Yes. So those that are not part of your household or part of your bubble have to be 6 feet away from you. So the tables, and we go out, like I said, we have compliance teams that go out, so they ensure that these things are in place. So if we maintain those precautions, it's okay and it's safe to dine outside.
We talk a lot about masks. How about shields? Do we need to wear a shield as well in conjunction with a mask?
So for us, like regular, the public, we don't, we're not saying that you need to wear face shields, but for some service providers like servers, that's an additional protection that we ask them to do. But for regular citizens, as long as you're wearing your face covering the way that you're supposed to, covering your nose and your face, that's what we're asking.
And one more question, since we are talking about transmission. A lot has been said about the protests during the last few months, and there were some that were very well attended protests. I happen to live in West Hollywood, and I saw some of the protests that went by Santa Monica Boulevard, and most people were wearing masks. Have we seen in LA County an uptick in the numbers of positive COVID cases? And through the contact tracing, can that be associated or pointed to people who participate in marches?
So yes, we think so, right? But when we're doing our contact tracing, we're only finding out, we know who the close contacts are. We rely on the cases to tell us, right? And sometimes, especially with marches, they can't identify those. But we have seen that with the marches, when we reopened, that there have been an increase in cases, and like Dr. Riggs said, the population that has been affected are like the younger people. So we know that this is based on, gatherings, reopenings of the younger people who have been gathering.
Great. Thank you very much. Now, let me...
Hernan,
yes, go ahead,
add
Doctor.
one thing about
Absolutely.
the face shield so that people can understand why the servers in the restaurants may be wearing them. The people that are eating don't have masks on.
Exactly.
So if they were to sneeze or to have a cough or choke on some of their food or something, those particles could be expelled and they could go into the eyes or mucous membranes of the eyes. So that's why folks that are around people that are not that don't have masks on may indeed be wearing face shields. But for the regular public, there's not unless you're going to be around people like in a patient care setting or something where people can't have masks on for the procedure or something, then it's really not indicated. So if that mechanism helps for people to understand why the servers might wear them, but the patrons don't need to.
And I saw since we are on this issue of masks and shields, I saw one of the members of the public asking a question about gloves. Are gloves something that we should be wearing? If you can answer that briefly.
Well, I mean, so gloves, it depends on the frequency and how long and for what. But so, for instance, if you're fearful that you're going to, come across an infectious agent, then you can wear gloves and you have to take them off. But if you're also doing that with your hands and you wash and gel and take appropriate hygiene, then the mechanisms of action are no different. There's not really, at least Cristin may know this better than I, but we don't really have antiviral gloves on the market that are killing at a contact at this point. I mean, there may be some in special circumstances, but they're not there for the public use. So gloves can transmit pieces, but if you can't do your hygiene, many people in our care settings, we are double gloving in order to be able to take the external one off and then continue with care at the bedside, going from clean to sterile. So there's a lot of different reasons for using the gloves in the community. If people feel more confident with that, or they're not able to clean their hands, then I would just say that you have to be very careful about how you take the gloves off, including from the middle, not underneath, right? You have to take it from the middle and take it off. Same on the other side, because otherwise you're spreading you could potentially spread germs up underneath.
And ultimately, correct me if I'm wrong, ultimately it's about not touching your nose, your face, your eyes, and then, as you well said, practicing hygiene and continue to wash your hands often. And if unable to wash your hands, perhaps carry some hand sanitizer that is FDA approved to protect yourself.
Yeah, this is Cristin's area.
Yes, that's correct. I mean, Dr. Riggs spoke to it very well. So yes, so if it makes them feel comfortable, go ahead. But like for the general public, what's more important is really hand hygiene. It's making sure that you're washing your hands, you're sanitizing, so that and that you don't touch your face, like you said, your nose, your eyes, your mouth. Mm-hmm.
One more thing in transmission, much has said about whether this was aerosolized and it was present in the air. Unfortunately, the president seemed to know about this, hesitated, or basically denied the truth to Americans. And I'm not being political, but that is a fact that we just found out recently. And then the CDC reinforced that idea by reminding people, when I go shopping to a market, how concerned do I have to be, particularly some of these markets that are not really controlling the amount of people that are coming in and out and the volume of people breathing inside of a closed store?
Well, there's a lot in that statement. Again, 6 or 9 months ago, we knew very little about this virus. And we do know, what we do know is that it's easily transmittable, and that we know that it can be aerosolized, and we do know that. So there's a whole discussion around sort of the size of droplets, the force of droplets, and all of these different things. And so it's really difficult to have a blanket statement around what one should or shouldn't do. But I mean, our family's individual choice has been to go to markets where they do control for amount of folks that are in there, as well as wide open spaces. I think that the markets and businesses have been very ingenious in how they've adapted, and we should support those folks in the appropriate adaptations. But I have left stores when I have felt uncomfortable, especially when people are not masked at all in certain circumstances. And there's some people that really have a difficult time with the mask, and I understand that. But I want to make sure that I'm doing everything that I can to not transmit it be a carrier in any way either. So,
right.
Yeah.
It's 11:45, and I do want to go through the questions that the public has sent. So I'm going to ask you if we can have some quick responses. Switching from transmission and what people can do to protect to those who are already sick, can you tell us a little bit about what happens inside an ICU? Some people and I mentioned this before, some people are not taking seriously, getting sick, but those who go into ICU, particularly those who have to be ventilated and with mechanical ventilation and have to be put in an induced coma, I think it's the term. Can you describe to us what it looks like inside an ICU, particularly with these patients that get really sick?
Right. So in general, in our ICU, if you've been at Cedars, you know that the external doors are all glass. And so in general, we have a caregiver in there, and then we have a runner going back and forth outside in order to bring supplies and things in, because the donning and doffing of the PPE in and out takes time. And oftentimes, many of these patients, when they're ventilated, they are one-to-one. We have found that prone ventilation, meaning not laying on your back, but being on your stomach, actually has been helpful in clearance of secretions in certain patient populations. And we're studying what that looks like to determine the best metrics around that. But you'll see, lots of, equipment and drips and, breathing machines, all of those type of things. So it's a very intense setup, and we have clean and, I would say clean and COVID zones, meaning that we have, lines on the floor of where clean areas and COVID areas are, in order to facilitate the care and decrease the potential, any potential of any transmission in the hospital.
And some of these patients that are ventilated have to be sedated, correct, to the point that they are unconscious?
Well, early on, we were paralyzing them in order to make the ventilation more tolerable. And yes, sometimes there is indeed sedation that accompanies that. And but we also know that there are, the long-term sequelae of post-ICU syndrome, or PICS, is coming out now, and we're just beginning to understand the physiologic, emotional, and cognitive impacts. And we're setting up actually a clinic here at Cedars to help facilitate the recovery of those folks that have had this post-ICU intensive care. But we've had people, that have stayed, 70, 80, 100 days in our facility, and they're very, very deconditioned. And so we're just beginning to understand how we can help them recover to get back to their life.
Since we are talking about patients who are sick and admitted to medical care, can you tell us a little bit about, and you mentioned several times, and I appreciate that, how your colleagues and yourself who are fighting COVID are learning every day new things. They are sharing knowledge of what works, what doesn't work. Much has been said, for instance, about the plasma of formerly sick patients with COVID. The president mentioned several times hydroxychloroquine. First it was good, but then it wasn't. What are the things that your colleagues and yourself are using? If you can briefly describe that for us.
I'm happy to. We have a whole team that we have several teams that are looking at the literature that's coming out. Not that all of us in medicine don't think we have the ability to go back to medical school and learn about a new virus, but there's been over 2,000 publications that have come out since the spring, and there's no way that any one person can analyze all of that. What we found from the literature is that, of course, prevention, PPE is very important, and the remdesivir and dexamethasone currently right now are treatment, as well as for the virus and mitigating the effects of the virus. And then for folks that are hospitalized, it seems to have a coagulopathy attached to it. So we're closely tracking DVT prophylaxis, or venous thrombus prophylaxis, because many of one of the literature from New York showed that many of these people were dying from clots that were formed when they weren't anticoagulated. And so there's a prevention piece, and then there's also a treatment piece. The plasma, we're beginning to understand where that might be most useful. But again, we're reviewing the literature on an ongoing basis to understand what we can do to support this until we truly have a definitive treatment.
Can you get COVID if you had it? Can you have it a second time?
Yes, there's been several well-documented cases in the literature of this. That's one of the things we're beginning to try to understand about that. We know that through the state project of mapping genetic variants of COVID, we sort of understand that there's I'll say a Spain, Italy, New York, California or Washington strains, and we can tell that by the genetic markers. What we don't understand is in these reinfections, we're not to the level of where those have been run against each other to understand if the second infection was the same strain as the first one, or if it's like the flu where you could have several different strains and it'd be impacted. So again, as we get more sophisticated with our ability to do those type of tests and follow-up tests, then we'll certainly know more. But those cases, we hope, will be few and far between, although we do know that it is a possibility.
Well, and this next question is for both of you, Ms. Mondy, working in public health and monitoring the pandemic as it evolves, but also planning ahead of what could happen. And if you think about ahead, I'm thinking about influenza, but also you, Dr. Riggs, are going to have to be dealing not only with COVID, but with people very sick with influenza. What do you anticipate? How are you both in your different capacities preparing, and could this be the so-called and so much spoken about second wave?
Dr. Riggs, you want to go first, or?
Sure, I can. I'd say one of the things that I'd say is encouraging is that we were tracking the flu activity in the Southern Hemisphere, and that has been very low, very, very low. And so the same thing that prevents flu transmission of virus is what we're doing to prevent COVID transmission. And so we hope that our flu season will be very mild like it was in the Southern Hemisphere, in part mitigated by some of the health factors, the PPE and things that we're mask and hygiene that is happening here. The symptoms do look the same, and this is going to be discouraging for people that are admitted with some of those symptoms and they have to be isolated and aren't allowed visitors, until we get the tests back. But indeed, we are going to be running them simultaneously this fall as part of our flu panel when people are tested when they're admitted.
And I guess the suggestion is get your flu shot as soon as possible.
Exactly. That's what I was going to say. I mean, like Dr. Riggs said, it's very encouraging what we're seeing in the Southern Hemisphere, but, it's highly likely that both flu and COVID-19 will be present in LA County at the same time this year. So I think now more than ever, it's important to be protected from the flu by getting immunized, hopefully because we're, like Dr. Riggs said, the precautions that we're taking to prevent COVID is the same precautions that we're taking to prevent the flu, that like the Southern Hemisphere, we won't see as much during this flu season, but still it's very important to get immunized because we know that the flu vaccine is effective. So that one we can encourage people to do.
Great. We are talking about vaccinations, and this is an obvious question. It has unfortunately also become a politicized issue. Polls show that in early June, people were very, very eager to have a vaccination. Now they are less eager. What is the prospect of having a vaccine that is effective and also safe in the short term? And by short term, meaning before the end of the year or perhaps spring of 2021?
Well, let me break out my crystal ball because I do think that the early studies are showing promise in understanding, sort of how the vaccine may be able to be, manufactured and be effective and tested. I think that there's some significant differences with regard to the distribution of this vaccine. It's not stable at room temperature, and so there's at least what we know now, and so there's once the vaccine is actually established to be safe and effective, then there'll be a distribution and a challenge with regard to that. I mean, we're not going to have several 100 million doses to be given in a 1 week period or something. So I think that there's just the companies have come together to say we're not going to do anything that's not scientifically warranted, and we'll share those results to make sure everybody feels safe. And secondly, I think that the public health message, which I'm sure Cristin's going to speak to, will be very important, because we know that we've come to rely on our local officials and state officials much more than we have looking at the federal government over the course of this pandemic at this particular point anyway.
Cristin?
We're doing a lot of planning, certainly at LA County Public Health Department, and we're looking at the studies. So yes, we're going to make sure that messaging, I think, is very important for people to feel safe. I think with any new types of vaccines, and they were they're developing this really fast. Some people are concerned, but like Dr. Riggs said, we're trying to ensure that the vaccines are as safe as possible, and we're gonna share that information all of that information with the public before we start doing mass vaccinations. Mm-hmm.
In regards to the time that it would take to get everybody inoculated and vaccinated and protected, which obviously could be several months, the president, in one of his remarks in a recent interview, talked about herd immunity. And why is that a noble or not noble goal? Is that something that public health should pursue? If you can speak about herd immunity, and for the people who don't know what herd immunity, if you can briefly explain that.
Yeah, so we try to, just like with other communicable diseases, we try to vaccinate the population to protect we try to vaccinate as much as possible to protect the community, right? And just like what we do with measles, what we do with flu. But the challenge is, like you said, making sure that we vaccinate enough people in the population within a specific time frame for it to be effective.
Thank you. And I do have some questions on the chat that I would like to respond for you to consider. One of the questions is, what's the point of getting a COVID test, especially because there are some news articles about people testing positive and then negative and then positive again. I guess the point of the question is, the test is not highly accurate, correct? Or is it depending on which test is being used and the source of that test?
Right, so the sort of, I'll say, the quality control of many of these tests that are done not at sort of hospital level or county level labs can be variable, or like national level labs. So there's been many offices that are doing a lot of different types of tests, and there's lots of kits on the market that are marketing as emergency use authorization. And the reality is that the quality control test that we have done here over and over again and run against samples have been very, very sensitive and specific with regard to that. So if someone is testing, well, a couple of things. One can shed the RNA of the virus, which is what it's testing for in the PCR test, can hang around even though folks are not infectious, which is one of the reasons why there's recommendations not really to test again and again to see when there's no more RNA, but to really look at the clinical course of the disease process. But again, as we know, people can be infected, and so reinfected, and that's a possibility. So understanding the clinical scenario and what that positive test means is also variable. And also there's a whole piece around obtaining the sample. And I'm sure Cristin can talk more about that. But this was one of the early problems with swabbing was really understanding where and how the swab and the sort of, the testing material that would be submitted to the lab is just as important as the test itself.
So it was a matter, it was a problem with the collection of a good sample.
Yes, perhaps. And if you don't have really anything on there, you're always going to test negative, right? So, right, there's not going to be anything to run that. Yeah, so.
Yes, that's correct. So the type of test and the way the sample is collected are factors in that.
And Cristin, if you could briefly tell our audience, what's the current guidance for the people to test? How do you qualify to get tested? And perhaps more importantly, when you should get tested?
So we recommend that right now testing is really available, right? It's widely available more than ever all over the county. And we recommend that somebody gets tested if they have symptoms or if they have been exposed to the virus. Like if they were close contact, if they know that, there's somebody that they've been around that has been COVID, it has been tested COVID positive. So those are, but right now, because testing is available and we also know that a lot of people are asymptomatic, pretty much, you can get tested if you talk to your healthcare provider. If you don't have one, you can call 211, the county's information line, and they can connect you to the various testing sites that we have all over the county.
And this question is, I know the answer, but there is a question about, there used to be, Cedars used to operate a testing site which was funded by the county. The county redirected funds to other areas with higher needs. What are the prospects of having a testing site at Cedars, being that it's such a central and accessible facility for West Hollywood residents?
So our sister agency, the Department of Health Services, is actually the lead for testing strategies for the whole county. But I will say that, we've seen that that this virus affects people differently, that we've seen some health equity issues. And so we wanted to make sure that it's available in places where, there's higher risk. We've seen there's higher risk or there's not a lot of testing going on. But like I said, right now, testing is available. There's a lot of tests that's available all throughout the county. So hopefully people are able to get a test if they want one.
And we do still have our testing site, our drive-through testing site up and operational for folks that have orders for tests through their healthcare providers. So that is a possibility. And then of course, if they are symptomatic, you can look at urgent care places if you think that they need to have an evaluation and a test. But like Cristin's saying, there are resources for testing through LA County that are also open. They're just not, they don't have a site particularly on Cedars right now.
And you mentioned, Cristin, the equity issues, and just to mention to the audience who is watching us, this is a virus that has disproportionately impacted minorities. 50 or 51% of the people who test positive in LA County are Latinx, and another not small percentage are African American. So clearly the issue of equity is an important thing to have in mind. There are some few questions. Remember, I'm going to ask we were talking about shields, we were talking about restaurants. How likely is that you could, or is it possible to get COVID eating food at a restaurant that was prepared by someone who's sick?
So we haven't seen, studies doesn't show that, that's a common mode of transmission. the way that it's transmitted is through droplets. So, you know, what we have from our nose, from our mouth. And that's why if we touch things, even if there was COVID virus, that's why we make sure that, or we urge people to wash their hands, right? And don't touch themselves so that they protect themselves from the virus going in.
And related to transmission as well, the summer just ended, but there's a question about swimming pools and transmission via water.
You know, I haven't heard a lot of studies about that, that there, you know, that there's been transmission via water or swimming pools. I don't know. Dr. Riggs, are you aware of any?
No, the chemicals in the water should actually inhibit any of the virus in swimming pools that are appropriately cared for, should inhibit that from sticking around. But of course, swimming pools are oftentimes a place of lots of exuberance. And so those droplets could be expressed not there, you're in the pool, but you're in air, right? Your mouth and nose are above. So that's really the risk and not the pool itself.
Yeah, exactly. Because obviously you can't wear, when you're swimming, you can't wear a mask. So,
exactly.
So it's like open and yeah, when you're screaming, when you're, you know, the droplets tend to, it's farther than 6 feet, or like when you're enjoying the water. So yeah.
What about dental work or going, like for instance, this afternoon I had to go and see my optometrist. How dangerous is that, or how not dangerous?
The dentist and optometrist and all the different people that are caring for patients, that are healthcare providers, have been given very clear instructions on how and where their offices and the techniques that should be happening in between patients as well as with patients. Obviously, you know, assuming that the hygienist or the dentist is in their appropriate protective equipment, then they should not transmit it to you. The real risk is for you to be transmitting it to them, which is why in some places for, I'll say, really deep surgeries or deep prolonged procedures, people may be requiring testing before the procedure just as a precaution, both for their health of the patient, like they may not want to have that procedure if they know they're on the cusp of having an infection or are infected, but also for the providers, the physicians, or other healthcare providers that may be caring for the patient.
And very briefly, it's almost 12:10. I know that you, Dr. Riggs, have to leave soon. There is a question about the effectiveness of N95 mask, and this is a person who's 70 years old. Can it be reused? And more importantly, can it be revitalized, is the word that this person uses?
Well, I don't know how you revitalize it. We are reusing our mask. In general, the low-tech way is to actually let them sit for 4 days, right? Okay. So if you have,
the virus dies on its own.
But the reality is sometimes they do get worn out, and I don't know that there's a refurbishment program that's there. We are collecting our N95 mask and we're treating them in case we come up with a supply chain issue in the future. We're not reusing them now, we're just keeping them in reserve.
And very briefly, we are getting close to the holidays. We talk about Halloween very, very briefly. The holidays that will get tempted to people to get closer. What is public health doing, and I guess in conjunction with the state, to reinforce the message of continue to be careful?
So yeah, I think you might have heard in the news, you know, a few weeks ago, there's some that you know what the statement that public health gave, right? So right now we're encouraging activities that are still, able to social distance, some pumpkin carving within your family members, or some virtual celebrations. We're not prohibiting trick-or-treating per se, but we are strongly recommending against, going house to house or door to door, car to car for trick-or-treating.
And one final question, and this for both of you, because obviously both of you manage resources that impact the community. The longer we are with COVID, we have seen people not only be depressed because of the lack of socialization, unable to see their parents in some cases or their kids, but also losing their jobs, having anxiety. What are the programs available, or what is the county, for instance, and medical providers like Cedars planning to address these situations, making resources available?
So we have actually, that's a very real problem that we've seen and we've heard from the community. Through our sister agency, Department of Mental Health, there's a lot of programs that are available, and those could be accessed through their website.
Okay.
And from our standpoint at Cedars, we are trying to keep both everybody safe, well-informed, and of course our staff working. And for the community, what I would say is, that there are support groups. There are many virtual support groups that have sprung up, and virtual classes for that can deal with sort of being present, controlling anxiety, those type of things. I think that reaching out to people via this type of connection with Zoom or FaceTime or some other type of mechanism where you can connect with people is as important as ever. That's why you see many of the church services still occurring, Bible studies, connections with support groups, all again being done virtually, because this has shredded a lot of our need to, the social fabric. And we need to be aware of that, call it out. But mental health was a problem. Resources were a problem before COVID. And so this is just another strain, and much more in sort of, I'll say, everyday Americans or Californians' lives that have been impacted. And so I think, as Cristin said it really well, we all need to have a special place for kindness and compassion for our fellow citizens as we walk through this. That's how we're going to support each other to get through it.
Right. And for people who may need support, they can contact the City of West Hollywood if they are city residents. The Social Services Division has programs. The phone number is 323-848-6400. I know that there are some additional questions, and you may have some questions that you did not post to the chat. I invite all of you to contact Andy Lovano, my colleague in the Community and Legislative Affairs Division. Her email address is alovano, L-O-B as Victor, A-N-O, @weho.org. There was a question about what to do in situations where people are not following the guidelines. The city's code compliance and the sheriff are supporting enforcement of the health officer's orders here in Los Angeles, in the City of West Hollywood, in conjunction with Los Angeles County. I want to thank Dr. Briggs and Cristin Mondy for being with us. This has been an amazing conversation. The conversation doesn't finish here. As I said, if you have any questions, you can post them to us, send them to us and the city, and we will entertain them. If there is any final words that you would like to say, Dr. Briggs or Cristin Mondy, I invite you to do so. Yeah, just thank you. I appreciate the time that we spent together today. And what I will say is that, nobody's figured this out yet. So we all have to keep asking the questions and stay informed, stay safe, and keep each other safe. Thank you very much. Cristin?
And thank you to the City of West Hollywood for continuing to, host things like this to share information to the residents. And as always, I want to thank everyone, each and everyone who's been doing their part to keep us all safe. And thank you to the City Council for always allowing all of us who work for the city to do relevant, important
programming. This is obviously one of those things that we do. I am not only an employee of the city, I am also a resident, and many of my colleagues are, and we feel very proud of the city we work for and the work we are doing, and we invite the public to stay in touch and contact. And thank you again to both of you. You've been very kind. And until next time, I'm Hernan Molina, the Governmental Affairs Liaison for the City of West Hollywood. Thank you very much.